Okay, it looks like we got a good number of folks on. So I just wanted to say welcome to the July National Pilot Webinar. We're going to go ahead and get started. Remind everybody that these calls are recorded. So please mute yourself unless you're speaking. However, these calls are open forum. So feel free to unmute and ask questions, or you can add information to the chat as well. And if you miss these calls or you're interested in sending it to your colleagues, you can always send them the NBSTRN YouTube channel. All the calls are posted there as well. Here's our standing agenda. But before we get started, I wanted to welcome anybody that's new. If you are new, please unmute yourself and introduce yourself, and then we have a few announcements. Anyone new to the call?
My name is Matthew Ellenwood. I'm the Chief Scientific Officer at the National NPS Society, also one of the recent co-nominators for the NPS 2 nomination on the RUSP. This is my first time at the beginning of a call. I joined halfway through in May. Glad to be here.
Great. Thank you, Matthew, for joining us. We're glad to have you. We know we have a couple pilot studies that are coming up for NPS 2 and some other interesting things with states going on. So love to hear the feedback from you. Anybody else new? Okay, I'm going to hand it over to Nikki Armstrong from PPMD. I believe she has an announcement to make.
Thanks, Jennifer. I appreciate this opportunity. I just wanted to let everyone know that we did submit the RUSP app nomination package for Duchenne muscular dystrophy last week. So it's very exciting. And I wanted to take a quick opportunity to thank everyone who has worked together with us on these efforts, including NBSTRN, which has been our data management and data dashboard, and specifically Amy Brower, for their partnership, as well as the folks at the Newborn Screening Laboratory in New York State, who we partnered with on our pilot. So Michelle Gajana and Norma Tavicoli, and then also all of our industry partners and the folks from the other ongoing newborn screening pilots for Duchenne, both Dr. Richard Parad at the Cure Duchenne Brigham and Women's Hospital pilot, and Kate Casera and Holly P.A., and that team from the RTI Early Check DMD pilot. So we're just incredibly grateful for everyone's efforts to pull this all together, and I'm really excited to watch it move through the process.
Thanks again, Nikki, for the announcement. It will be interesting to hear about this, and I'm sure in an upcoming ACHDNC meeting more about the nomination. And I saw in the chat that Michelle Myers, the director of the South Carolina Division of Children Health and Prenatal Services, is new to the call, and welcome, and we're glad to have you as well.
Thank you. It's perinatal services, because we do both sides of the delivery, which we're thrilled to be able to do.
Sorry about that.
That's okay. It's and it could be my typing. It's one of those days, but I'm excited to be on this call.
Yes, thank you for joining me. No, it's not your typing, it's me reading. When I read things on the spot, sometimes I read them wrong. So thanks for correcting me. And then we also have another announcement from the NBSTR team. Dr. Ki Chen, do you want to unmute yourself and make your announcements?
Yes. Hello, everyone. I'm Dr. Ki Chen. I'm the Scientific Strategy Manager at NBSTRN, and I'd like to share with you with our newest episode, episode 12 of our podcast, The Newborn Screening Spotlight, is with Dr. Megan Pesh. She shares her journey to becoming a parent advocate and a researcher in cytomegalovirus, also known as CMV. She is an assistant professor of developmental and behavioral pediatrics at the University of Michigan, and serves as the president-elect of the National CMV Foundation. In this podcast, she shares her story, her personal story. Her youngest daughter has profound bilateral sensory neural hearing loss from congenital CMV, and this led to her involvement in national advocacy efforts to ensure that all newborns receive CMV screening. So please do listen to her podcast. And you can listen to Apple, Google Play, it's on Spotify, it's on Amazon Music as well. Next slide. So I am happy to announce that we have our upcoming Newborn Screening Network meeting. Many of you have already registered, which is great. I'm looking at the registration list. If you haven't, please do register. The Newborn Screening Translation Research Network hosts its annual network meeting. And this network meeting is to highlight our NBSTRN partners, stakeholders. And this year we have CDC and NICHD giving their updates. You will have an opportunity to chat with our speakers during the live Q&A session on each day. The network meeting is on July 19th, Tuesday, and Wednesday, the 20th, from 12 to 4 p.m. Eastern Time. We'll also introduce you to our NBSTRN staff, and we'll be conducting training sessions on NBSTRN tools and resources during the 3 to 4 p.m. Eastern Standard Time session. This year, just in the summary, we will learn from our speakers on the BabySeq2 project, which is an implementation study of the home genome sequencing screening in a diverse cohort of healthy infants. We'll also learn from our from Every Life Foundation on the recommended uniform screening panel alignment legislation, and also advocacy efforts on Krabbe disease and cystic fibrosis research from the Legacy of Angels Foundation, and also the new the EDEN, which stands for the National Newborn Screening Data Platform, which is developed by one of the branches at CDC. And we'll also hear about new screening efforts of early hearing detections and research development in congenital CMV. So we're really thrilled that we have a really great lineup. We encourage everyone to register. I'm going to type in the registration link on the chat, and also the speaker lineups for both days, so you can just look more about it. So here you can see here are our speakers, and I'll type it in the chat. So as you are getting throughout this presentation, feel free to just log in, not log in, but go to the website and register. It will only take less than like 3 minutes to register. So looking forward to having you as part of our network meeting. Thanks.
Thank you, Dr. Chen. And I just wanted to follow up with a couple more announcements. We are going to be changing these sessions up a bit. We're going to be sprinkling in some presentations. Next month, we'll have a presentation from Edward Goldman, and he will be talking about giving an update on the Michigan BioTrust Michigan lawsuit, and that will be on our next national pilot webinar on August 4th. And Edward Goldenberg, he is the president of the state of Michigan BioTrust, and he's also a co-chair on the NBSTRN's bioethics and legal work group, and is also a member of the clinical integration work group for NBSTRN. So please put that on your calendar. This should be an exciting meeting. I know we've been discussing, this has been one of the topics we've been discussing on some of our previous calls. If you also have a chance, there's another webinar that talks about legal challenges in newborn screening research. That's coming up, I believe, tomorrow. Tomorrow's Friday, where there will be Eric Hendricks from the Michigan Department of Health will be talking, and Goldberg from Case Western and Natasha Bonham from Expecting Health will be discussing legal challenges in newborn screening research. Another presentation we plan for these pilot webinars is discussing, since we have new nominations coming up, I thought we'd sprinkle in some updates about the different assays being developed. So PerkinElmer will be discussing this congenital CMV RUO assay on during the September meeting. So please look out for further announcements, and if you have a chance, please put it on your calendar. I'll just pause to see if there's any questions about those announcements. Otherwise, we can move on. Dr. Chan has posted the network meeting registration link in the chat as well. I can also post this meeting in the chat if you guys are interested in attending this as well. So with that said, I will go ahead. This will be the last month that we'll probably do all the state updates for all the conditions. Moving forward, we'll be doing updates on the pilot study conditions. So we'll still be hearing about Duchenne muscular dystrophy, and any other pilots that may be announced that are coming up. I know that the Georgia group is potentially might have a pilot for homocystinuria coming up as well. So we'll still keep the active pilots and the new conditions. MPS 2, we'll start be talking about that as well. But some of the, we'll be rotating some of the older conditions off, such as Pompe disease, MPS 1, SMA, and XALD off of these calls. I saw a few people from the New York group that are on the call today. I'm not sure who's providing the update.
Jennifer, it's Joe.
Hi, Joe. How are you?
Good. I'm going to provide the update. Just for clarification, will you be looking for GAMP updates next month?
Yeah.
Or the next time?
Yeah, I think that we would. I mean, GAMP would be one that we would look at. I know that GAMP doesn't change as much, so
Okay.
you know, that would be an easy one that you could probably provide for us.
Yeah, that's fine. I just wanted our crew to know so that we would be prepared. So just going over the older version of the list then. So for adrenoleukodystrophy, we only had one referral, and that was a baby girl. She did have a variant. It was our 140th referral. For Pompe disease, we actually had a few. We had 3 of them, making it 204 referrals total. One looks like it's likely a potential real case with a pathogenic and likely pathogenic genotype. I'm not so certain about what the likely pathogenic genotype was, if that was later onset or potential early onset. We haven't got that feedback on that yet. We had also a homozygous case for the common splice site variant. And then one was a compound het with the splice site variant and a variant of uncertain significance.
So you had 3 new referrals, you said, Joe?
Yes, that's correct. And for MPS 1, there were no changes since June. For GAMP, we did have 2 referrals, but I don't know if you know, but we are running Sanger sequencing on those, and neither of those had a variant. So we're not sure what those cases are, but they're still open and no diagnosis has been received as of this time just yet.
Has that been in your, I guess the Sanger sequencing for GAMP, that's been your protocol since? I'm guessing you just don't have a lot of positive cases.
Yeah, and it's more just, you know, for your information, we still will refer the babies just, you know, based on biochemistry, but the variants are there. I mean, they do give us some indication, obviously, if we've got what we, in this case, it's got to be something else causing, right? Giving rise to elevation, most likely, you know. Oops. And we had 26 referrals for that total. I don't think I gave the MPS 1 referrals, but I don't have that number offhand. And then the last thing was the spinal muscular atrophy. We didn't have any referrals since June, since our June call.
Any questions for Joe about the New York update? I don't know if there's any other thing that is coming down the pike as far as New York. Do you guys have any plans as far as some of the other conditions that have been recommended?
Well, MPS 2 is in our current pilot study, and we would like to transition it to full screening, but you know, we've got to be concerned with getting a budget appropriated for that. And then I think we don't really have anything else that under consideration right at the moment.
Okay. And then I don't know if you have any updates as far as the Screen Plus. If not, that's totally fine too.
It's still a fairly slow moving pilot, although there's a lot of movement at hospitals. We only have one now, but there's an additional 4 or 5, somewhere in that number, that we should be increasing our, so we'll see an increase in the number of specimens coming in. The total number of hospitals to have on board is 10. So we'll be, I guess, roughly at half the number once we're done. I'd say by, they keep telling me that'll be within a month or 2. So we've been gearing up for that. There's not a lot of, we've mostly had MLD positives. We've had 1 Fabry positive, but the MLD positives have all so far been false positives with no variants detected in the ARSA gene. We still need to bring up ARSA enzyme testing, and that's something we're working on here. We would rather do that first before the Sanger sequencing, because there are a fair number of positives by the first tier test for MLD. So it's essential to have an ARSA enzyme assay with that as well.
Joe, this is Debbie Friedenberg, and I have a question about your GAMP deficiency. When you do the sequencing and you don't find anything of your presumptive positives, do you then look at arginase? I know you do it, we have analytes on the routine screen. Do they look further, or that really hasn't been worked out yet?
Externally, I'm not sure what they're doing. Maybe Michelle or Colleen would know, but I know once we refer it, I'm sure they're doing some form of differential diagnosis on there at the diagnostic centers, but I'm not certain of what they're doing.
Thanks.
Yep.
Yeah, this is Michelle. We have 1 baby who ended up with arginase deficiency after the GAMP referral. We're not doing anything, additional outside of looking at the analytes from our end on the biochemistry on the mass spec. So we're not looking at the gene or anything like that. I'll add too that these 2 babies, these 2 referrals, one of them passed away and the other one was very ill in the NICU. Because there were no variants detected in the gene, it's likely that these were false positives due to some, treatment interference, or just the fact that both these babies were very, very ill.
Thanks, Michelle.
So I'm guessing you guys don't look at arginine. Do you look that in the lab as part of your screening protocol, or is that just done on the diagnostic level?
Hang on a second. I think we have arginine on our panel.
Yeah, it's on the mass spec.
Yeah. But I don't think we've done anything more than carry it along at this point for a marker. I don't believe we have it associated with anything. Know of anywhere. I'm looking now. I don't see what it's associated with. Arginemia. We have an arginine to ornithine ratio, but I don't even know. Yeah, that would be our. Yeah, I mean, it's on there. Whether I don't know much more than that, honestly, at this point. One of those things for me to learn at this point. Our co-worker Mark Moresi retired, and this has now become my territory. So I guess I better start looking.
And I think Joe from the Arizona lab put some information that for the folks that are screening for or piloting Pompe and NPS1. If you guys can help me out and share your contact information, that would be great. It looks like their lab is planning on doing some testing. And Joe, if if I can also follow up with you if you contact me afterwards and try to get you connected with some of those laboratories as well.
Okay.
This is from he's from Arizona. Any other questions? Oh, no problem. Any other questions from the New York team? Yeah, I think that this is probably knowing about your arginase referrals makes it even, it's great that we're getting more information about the GAMP deficiencies, because I'm sure we'll find more information as you guys move along. I know that there's not a lot of referrals, which is, I guess, a good thing, but getting more information about that would be great in future calls.
Okay.
If there's no other questions, I'm going to move on to the North Carolina team. I am not sure who's going to be reporting out.
This is Kate. I'm here.
Kate, how are you doing?
Good. How are you?
Good, good.
All right. So for DMD,
Mhm.
we are at 11,218 babies screened. We've had 72 screen positives. And then we had 61 of those. The parents consented to next generation sequencing. We've had 49 of those were negative. And then we have still the same two positives. One is pathogenic variant in DMD, and the other one is dominant CLCN1. As last time, we already have those there. And then we have, we've picked up 4 autosomal recessive heterozygotes and 5 expected autosomal recessive.
So
And
is this in addition to your 9, or this is it?
no, this is part of that. So it's 9 are carriers or likely carriers, and 2 are positive. So one is DMD and one is autosomal dominant CLCN1. So it's all together. Let's see, I'm trying to read what you wrote. 9 carriers. Yeah.
Good. Okay.
Yeah, that looks good. And then we've had 54 who consented to a blood draw. So latent CK, total CK, which we do at 1 month of age. And there were only 2 that were slightly elevated, but neither had a finding on the sequencing panel.
And just to remind us, so you're testing for how many? This is an NGS panel, correct? And how many? Do you remember how many different genes you're just testing for?
Correct. And I think you've asked this question before, and I always forget the number. It's and I should put it on my slide. I do not remember. I want to say something like 70-ish.
Okay, that sounds good.
And neuromuscular panel, yeah.
It's a neuromuscular panel. Okay, very helpful.
Yeah. And that's it for DMD. For MPS II, we're not live yet. We are currently testing the population in the population study to see our distribution and set the cutoffs. So hopefully we can get that done soon and get the data analyzed, and hoping to go live soon. And so this means that that recent achievement was that we finally have in place a DOA MTA with the state for the specimen. So we're in mad dash to get the population study done with de-identified specimens. So it was a big thing to get done in place.
It's great. So Is there a projected start date or not yet?
Hopefully soon. That's as much as I can and tell you. So,
Mhm.
it all depends on whether testing will go smoothly and data analysis and approvals in place. So
Yeah. And the testing for MPS2, that's going to be done at RTI, is that correct?
correct. So we're punching the specimens at the state lab, and we're doing the testing at RTI, and referring to UNC to Dr. Munzer and his team, and having confirmatory testing done at Duke, and having second and third tier dry blood spot testing done at PerkinElmer. So we're doing both. We're not using it as true second and third tier. We're just using those data as for research purposes, and also to inform the follow-up team if we find anything. But we are referring all screen positive newborns to UNC, regardless of the second and third tier.
Okay, regardless. Okay, so all
Regardless of gags and sequencing, yes.
okay. I haven't asked this in a while. I'm not sure if anybody from the North Carolina team is on that wants to give an update about what's going on in the as far as the state lab. I'm not sure if you know, Kate, but if not, that's fine too.
And you were breaking up. You were asking about.
Oh, can you hear me now? Is this
Yeah,
better?
I can.
Okay.
I know you were asking about other conditions, but I don't know which ones you ask. I don't have the answers, but I just want to make sure that I didn't miss something that I can answer.
No, I
Can
was
you repeat?
wondering if they had recently at MPS one SMA. I think that I'm not sure if the state has added MPS one in Pompeii yet. So I was wondering if anybody had an update on that.
Yeah, the state lab should answer that. They've been screening for SMA for over a year, and they are also screening for XLD.
And XALD. Okay. With the silence, I'm assuming I'll just assume that no one from the North Carolina State Lab is on the call, so I will not ask that question. And I'll move on. Does anybody else have any questions for Kate about the testing method or her validation for MPS 2? They're starting their pilot soon, or anything about the DMD pilot? Okay, so I'm going to move on to Georgia. I know Angela said she's not going to be able to make this call, but I see Dr. Wilcox is on, so I was wondering if he was able to give an update.
I don't have any numbers, sorry. Angela just got back from vacation. She's the one who has to pull it. We just have a new newborn screening laboratory director. She started recently and she's getting settled in. I'm meeting with her tomorrow. And we'll see about when we can start up the disorders with elevated homocysteine pilot that we have planned. And we're, as a state, planning on applying for the CMV screening.
Oh, great. That's great to know. Have they made that announcement formally about CMV?
No. It's the task, the draft task orders come out. So we are looking at that, and we're having a small group who's going to work on that. And I'm obviously not going to be the one driving that as a geneticist. It's got to be somebody who knows that a lot better than me.
Okay.
So we'll just help out with the mechanics and get it all set up since we've done so many of these.
Well, congratulations on recruiting the new lab director. So congratulations on that. Glad to hear updates in the future about starting up the homocystinuria pilot as well.
Yep.
Okay. And also I see Dr. Prad is on. Would you like to give an update this month about the Duchenne pilot?
Sure, I have some new numbers, but not too much excitement. We've now screened 5,763 babies. 22 of those are males. And we've referred 151 to whole exome sequencing for elevated CKs. We thought maybe we had our first detection. I think perhaps the last time I spoke, we had a male with a 7120, but his sequencing was negative for DMD, and then he had a repeat CK of 94. So we did not expand our search on that baby. And we still have 3 female carriers, one of a VUS, one of a deletion, and one of a duplication in DMD. We are working hard towards an expansion to a second hospital in our healthcare network. They have about 5,000 deliveries a year, so we're hoping to pick up the pace a little bit more and screen some more babies. And that's all I have.
Yeah, I know during the last meeting, and if you didn't get this information, that's fine. I know Dr. Friedenberg asked or someone asked about ABGARD scores or this number of C-sections versus vaginal, and I didn't know if you had any additional information about that.
Yes, so I'll thank Debbie for the great question. We are, our data management has not been, not being in a newborn screening system, it's been a little challenging. So we've just recently hired someone who is just about to get a REDCap database up and running that will allow us to formally integrate the information from the medical record with the information from the laboratory. I thought maybe I would have that today, but we're not quite open for business yet. So perhaps at the next meeting, but as soon as I know, I will be happy to present that information.
Oh, thank you. Yeah, thank you so much. Appreciate that. And Kate, I'm not sure if you guys are collecting that information for your study as well.
I'm sorry, what information?
The type of birth, like if it was a C-section versus vaginal.
Yes, we are, and there's a lot of various information that one can get, and we're that's what we're interested in too.
So I guess there's not been an analysis done yet on that.
Correct.
Okay. Yeah, it would be interesting to hear from both of you, maybe to get more numbers as far as those and see if the combined data set comes up with anything as well.
Yeah, certainly.
Yeah, we're also trying to squeeze out duration of labor from the medical record. That's a little more challenging, but we may have information on that also.
Okay, sounds good. Any other questions for Dr. Prad about his, the DMD pilot? Okay, I'm going to move on and see if there's any other updates from any other states. I know that we just heard from Arizona that they're looking to do a pilot on, I think, Pompeii and MPS 1. And if I believe it was, if they want to unmute, anybody want to unmute themselves and discuss their plans for that, that would be great. Of when you plan to start the pilot. Or is anybody else doing any new pilots? Anybody adding the new conditions? Oh, I hear someone unmuted.
Yeah, this is Debbie Friedenberg, and it's not a new pilot, but we were just notified that we received the CD grant for enhancing disease detection with newborns building capacity in public health labs. And we're going to utilize that funding to help implement NPS 1 in Pompey's, which we are not screening for currently. And also as NPS 2 gets added on to the rest, that will be part of that as well.
Okay, so so Texas isn't screening for NPS 1 in Pompey currently?
Correct.
Okay, but that's something that you are looking to add, I guess, with the new.
We're already working on an implementation plan prior to this, so we're working on that.
Okay, but the new funding is going to help
Correct.
supplement it going. Got it.
If we're talking about funding and pilot projects, I will put out a pitch that the society funds research grants, and we are anxious to get someone to think about putting on NPS 6 and 4A. PerkinElmer does sell substrates for those. They have approved therapies. We are really anxious to try and get a pilot for one of those to help drive a successful RUSP. So if anybody is thinking about that, give me a shout, please.
Thank you for that information. I know these are the two of these two conditions are on the New York Screen Plus pilot. That correct?
They are.
Okay. But further, I understand that further pilots are needed. And one other thing is their funding. So if people that can contact you can also inquire information about funding.
Yes, we have an active funding program. We put out $1 million a year now for the last 2 years. We'll be thrilled if there are pilots that are interested. Our largest grant is $100,000 that can be put in for a year, and that there is also the possibility for a competitive renewal so that you could get up to $200,000 over 2 years. So especially we need something for NPS 6. NPS 4A patients have been identified in Taiwan, so that program does fulfill sort of the one patient rule for the RUSP nomination, but we have now no patients identified for NPS 6 in Taiwan, and so we're anxious to get a large state to pick that up.
Matthew, one last question for you. Can you remind us, if you on the call, what's the projected incidence rate for these two conditions as well?
NPS 4 is difficult to predict. There are certain communities where we see definite founder effects. We see these internationally, and I assume these will probably be found in certain states, depending on their ethnicities. And I can't give you a solid number on that. My expectation is it's probably 1 in every 100 to 200,000. NPS 6 is probably lower than that. It may be up to 1 in every 250. We don't really have good numbers to estimate this. In Taiwan, the incidence is quite high, but they clearly have a found mutation in that population that increases their incidence.
Got it. Mm-hmm. And do we have any other questions? Any other comments on the call from other folks? Anybody starting a new pilot, or any questions about the information that that Matthew just provided?
Hey, Jennifer, this is Tanya in South Carolina. Can you hear me?
Yes, I can. Mm-hmm.
Hey, I was just going to share, I hadn't been on the call in a minute. I think on the last call I shared with the group that the South Carolina Newborn Screening Program had started testing for Pompe and NPS 1 last February 2021. And the laboratory is currently doing validation studies for ALD and SMA. The lab is going to be multiplexing the SMA with our current skid test or new skid test. So just wanted to share that little tidbit.
Thank you so much, Tanya.
You're welcome.
And as far as your for NPS 1, are you guys doing any or even Pompe 2, are you doing any second tier testing? Are you doing gags or sending them out for gags?
Yeah, we're doing Sanger sequencing for both Pompeii and MPS1 by a referral lab in the area. They do the testing for us for free.
Oh, wow, that's a great deal.
Yeah, sweet.
Thank you for sharing. Do we have anybody else on the call that would like to give an update?
Hi, I was gonna say hi, it's Fran from Arizona. Uh, excuse me. So we just identified our second true positive SMA within the past week. So we started screening January 1st, and we have 2 now that were positive with 2 copies of SMN2 and both treated with Zolgensma. We still, we're screening for XALD since January 1st as well. And we still have 1 true confirmed positive for that we had in January, but nothing since then.
Thanks again. Thank you again for the update.
Sure.
And if this is, if these updates, I mean, I appreciate everyone giving us updates on this call. If there's information about adding these new conditions that you would want to further discuss on these calls, I know this has been very helpful for programs that are going to start to add these conditions. But if there's things, you feel free to please reach out to myself or Dr. Amy Brower, and we can make sure we include that information, that discussion on the upcoming call as well. And if there's no other updates, I was going to hand it over to, I think Kashia's on the call. Did you want to give an update from APHL?
Yes, so we have 3 upcoming, webinars and meetings. So the first is we have a RUSP alignment webinar coming up next month. I mean, not next month, but next week, next Thursday, June 14th. We will have Iowa and North Carolina presenting their experience with that process. We also have Every Life Foundation presenting as well. And then in August, we have the APHL New Steps Continuous Quality Improvement National Meeting, and registration is open for that. We have sent that out to the community as well, so you could either use this link or the link that's in the announcement as well. And this meeting is scheduled for August 10th to the 12th, and it is in Washington, D.C. And then in October, we have our newborn screening symposium. That is going to be between October the 16th to the 20th in Tacoma, Washington, and registration will open for that this month. Thanks.
Kashia, do you know when they'll be letting us know about abstract submissions? Do you have any idea for the meeting in October?
I think it will be soon.
Okay.
You mean whether or not
it was accepted?
Selected? Yeah. That should be soon.
Okay. So we'll look forward to getting the notifications about that in the final agenda. I look forward to seeing everybody in person, if you're going in person in Washington.
Thank you.
No problem. Does anybody else on the call have any announcements? So we just have a few minutes left. I'll just remind everybody to register on our website. If you haven't done so, you can check us out on social media. And again, our next call will be August 4th at 2 p.m. Eastern time, and we will be having a presentation from Edward Goldman. So I'll give you guys a little over 10 minutes back unless anybody has any other closing thoughts, but thank you again for attending this meeting. And have a good day. Bye-bye.
You too, bye.